Hello, and welcome to the National MS Education and Awareness Month Conference, hosted by MS Focus, the Multiple Sclerosis Foundation, and made possible with support from Biogen, Genentech, Novartis, EMD Serono, Sanofi, Viatris, and Bristol Myers Squibb. I'm your host, Aaron Fine for MS Focus, and I'm joined by Dr. Amber J. Landers, who will be talking to us about health equity. After a presentation from Dr. Landers, we'll open it up to your questions and comments. Now, I'm delighted to introduce our speaker. Dr. Landers is a clinical psychologist with experience teaching, consulting, and providing brief interventions in community, hospital, and school settings. Her interests include reducing stigma and implicit bias and promoting health and mental health access for undeserved populations. She's obtained her BA from the University of California, Riverside, and her PhD from Purdue University. She completed her doctoral internship and postdoctoral fellowship at Harvard Medical School / Cambridge Health Alliance, where her training focused on assessment and interventions for mental health, chronic illness, and developmental disabilities in family medicine and pediatric primary care teams. Dr. Landers is currently an assistant professor, assistant program director, and coordinator of the Integrated Health Track at California School of Professional Psychology, San Francisco Bay Area campus. She continues to consult to agencies in the Bay Area. Dr. Landers is a proud mom of a toddler, and in her free time, she enjoys competing with her husband to make her little one laugh. She also enjoys yoga, Afrobeats dance workouts, and gummy bears. We're pleased to have her join us to present this important topic. Dr. Landers, thank you for being with us, and we'll turn it over to you.
Thank you so much for that introduction. I'm going to take a moment to share my screen so that we can all see the same stuff. There we are. And I'm going to move some stuff around so that I can make sure I'm not blocking anyone's view. All right, so yes, thank you for that introduction. I'm going to be hopefully having a conversation with you all about health equity and advocacy in MS. I mentioned as I was joining the call today that, this is a topic that's near and dear to me in terms of health equity. I do a lot of presentations on health equity, health disparities, implicit bias. And typically it tends to be a doom and gloom kind of conversation. And so I was excited to do this one because I was tasked with talking about health equity from the standpoint of advocacy and things that we can do as individuals to make sure that we're able to, or at least to increase the likelihood that we're able to kind of live our best lives and navigate through some of those things that are those health inequities. So I'm hoping today that will be most of the focus. There will be a little bit of doom and gloom just as an introduction of what we're talking about, but then we're gonna kind of shift into, well, what is it that we can do? If we were to leave here today, what are some things we could think about doing to minimize those health inequities? And so what I hope I can do today is define health equity and inequity, clarify some of those concepts that are related to health equity, but aren't necessarily the same exact thing. There's a lot of overlap. For instance, health disparities, as I mentioned, implicit bias. So it's helpful to understand those because they all factor in, but as well as understanding what health equity is. I hope to describe some of the impact on folks with multiple sclerosis. And then, like I said, to identify strategies for empowerment and for advocacy, mostly at the individual level, but we'll talk a little bit more about that today, or I'll talk about that, right? So starting with that first objective there of defining health equity and inequity, it is really helpful to see these next to each other to see what are we talking about when we talk about health equity and when we talk about health inequities. Well, health equity is when every person, right, has the opportunity to attain his or her full health potential. Again, like we say, living our best life. Like there are no obstacles to living our best life. That would be health equity. And no one is disadvantaged from achieving this potential because of any social position or any other socially determined circumstances, right? But health inequity is based in those implicit, those kind of embedded power structures that disadvantage folks based on things like their background, their resources, or their access to resources, their financial situation, their income, their social economic status, their disability status, or even the presumption of a disability status or the presumption of an able-bodied status, right? And all these things impact all aspects of health. And this is what makes health inequities so ubiquitous and insidious, is that we may not see it on the outside, but we may see the impact of it. And it may be touching our lives and impacting us in ways that does impact us, and we feel it, but it's hard to kind of pinpoint where it's coming from. And that's where the embeddedness in those power structures come in. And it affects folks, it can affect health outcomes, folks' just general well-being, and that ability to thrive. So again, when we're talking about equity, we are talking about removing some of those barriers or navigating so that those barriers do not impact us as much. So I like this visual. You may have seen different versions of something like this. But when we're talking about equity, right, we're talking about differential needs and providing, or at least diminishing obstacles so that we can help folks meet their individual needs. This is different from equality, which is about kind of a one size fits all, or assuming kind of everybody has the same needs. And while that's good intention and that works for some things, when we're talking about health, and we're talking about well-being, that may not be enough, right? So if someone has greater need or their individual needs are different, then we need to address those so that they can have access to their full well-being, right? And as we all know, right, individuals with MS have different experiences. It's a very individualized experience. And so if we think it's one size fits all, we give everybody the same thing and nothing else, we're not actually helping folks meet their needs, right? So we do want to think about equity in terms of individualized needs, understanding power and structures, and how we can help people reach their potential or reach the apple on the tree in these kind of images here. And so just summarizing that a little bit. So health inequity is about that unevenness of power and how that kind of impacts folks in their day-to-day access to the things that they need to live their lives. While health equity is more about empowerment on those different levels, right? So that can be the individual level in terms of interpersonal. That can be healthcare, which is mainly my focus for today. That can be in the community, right? And that can also be at the policy level. So we can also think about these things as kind of like these circles that are like embedded with each other, the individual and their healthcare within their community, all impacted by policy. We want to be empowered at all those levels. Because if we're not, these inequities are coming up in differences in length of life, differences in quality of life, rates and distribution of disease across different populations and subpopulations, disability, death, severity, all these different things, right? Again, a little bit of doom and gloom just to give us some background, but we're also going to talk about what we do about some of these things. And so we do have to talk about the differential power, and we do have to talk about what happens in healthcare interactions, and we do have to talk about the broader healthcare system and social structures that impact them so that we can achieve health equity, right? So that we can think more about inclusive decision-making and resource allocation that's based on need and how to get needs met. And so a couple of things that are related but not the same thing, health disparities, right? We hear that term a lot. And that's more about differential like health outcomes of certain groups over others. And that's related, but you'll see that health equity is not just about health, right? It's about kind of whole life stuff. Power and privilege, we were talking about resource allocation. So power and privilege comes up when in interactions, as well as on a larger system level, when there's kind of poor communication or assumptions being made, assumptions of disability status or not disability status, or other assumptions even within disability of what someone's able to do and what they're not able to do, that's not based on kind of an individuation of each person. A lack of partnership in this shared decision making. Later, when we talk about strategies, we'll kind of talk about how to kind of flip the script, as I call it, to kind of regain some of that power that can sometimes be implicitly lost in some of these interactions, especially in like a hierarchical system, like a healthcare system. You might see lack of respect, or just in general, kind of an overall lack of trust, right? Cultural competence is one that comes up as well, because sometimes when we're talking about health equity and we're talking about power and privilege, we're also talking about different cultural groups who are impacted in different ways, right? Again, that thinking about that individuation there. But when we ignore power and we kind of focus just on understanding cultures, we then only focus on kind of a knowledge base and not necessarily the power structures that may be contributing to differences in health, differences in well-being, differences in thriving. And so it's not to say that cultural competence gives us a little piece of the picture, right, in terms of understanding culture, but we need to kind of expand that to also understand how that impacts these other areas that impact people's lives in their day-to-day as well. So just knowing about a culture, oh, I know this about this group and I know this about that group, doesn't necessarily help us individuate to an individual's need, right? So health equity kind of brings that in a little bit more. Sometimes when we're thinking about equity, again, we mix it with equality and we think, oh, this means like treating everybody the same. And while that comes from a place of good intention, it can actually hinder folks, again, from getting the services or getting being heard in their actual individual needs. And when we see that at the policy level, or structures, policies that ignore individual difference or need, they actually have a negative impact, right? When we say, oh, everybody's the same, that means everyone can access this building the same way through these tall stairs, or that everyone has, access to the same grocery stores, right? Then we're not really thinking about the individual need, and that can negatively impact those folks who have visible and invisible disabilities as well, right? So people saying, you don't look sick, right? You're just like me, where that may not be the case in terms of how the needs that each individual actually has. So I'm going to spend a little bit more time on these, one, because they're my babies. However, they are things that will come into play when we talk about some of the strategies that I hope to focus on today. And so implicit bias, social determinants of health, and quality of life are also related to health equity because they're about relationships. Social determinants of health are about those non-medical factors that influence health. So again, neighborhoods, environments, access, things like that, nutrition even. And quality of life is how much a person can enjoy the valued possibilities of their life. So that goes back to this living your best life and the ability to thrive, and challenging those things that get into the way of those ability to, again, enjoy the best kind of possibility of one's life. And so with biases, we often think about biases and racism, which is really important to think about. But I want to bring in other things as well, as primary language spoken. What do you do if you are a Spanish-speaking person with MS and you're looking for a neurologist to speak Spanish, right? Are you looking for interpreters? Are there any in your area? That can, again, affect quality of care, or at least even perception of quality of care too. Gender, sexual orientation, education, employment status. So again, all these characteristics that make a person an individual can also be the focus of biases that influence their healthcare, their treatment, and their well-being, right? On the broader scale, but also in that interpersonal level of communication and the treatment that folks get. For example, so again, implicit bias, I mentioned that's one of the areas of focus that I do work in, is associated with poor quality of patient-physician communication, right? Poor quality of that communication during a visit, as well as lower ratings of the quality of the encounter. So how the person felt after the encounter. Did they feel like they were getting good care? Did they feel like their needs were being attended to? Did they feel like they were being listened to? Did they feel like they were being valued, right? And so we talk about implicit bias because sometimes those things factor into those interactions, which then factor into the care, right? And we'll talk about some ways to kind of navigate that, or at least kind of interrupt that process a little. We know that explicit biases and implicit biases. So explicit biases are the ones that are conscious biases. We have a bias that, oh, folks that look like this do this, or folks that are from here are like this. So that's more explicit. We're aware of it. And implicit bias is more that unconscious kind of automatic thought that comes into our minds. We all have them, right? But they can be have negative impacts on our healthcare when our the folks who are caring for us also have those implicit biases, right? And so we could, talk about eliminating biases, but that's only one factor in achieving health equity. That's only one kind of interpersonal factor that that addresses kind of health equity. There are other things as well. I mentioned social determinants of health. This is just a reminder that, again, health equity is like a big thing, right? It's not just biases and racism and sexism and these things. It also is bigger and the impact of those things. So education, employment, work-life conditions, nutrition and food security, housing, all these things that impact people's worlds and their day-to-day interactions and their day-to-day ability, again, to live their best life are things that also impact their health, right? Mental health, physical health, as well as healthcare, right? So if you look at this little diagram here, they're talking about education, they're talking about access, they're talking about neighborhoods, right? And not just where your neighborhood is located, but how is your neighborhood built, right? Is it an accessible neighborhood to you? Is it easy to walk on the sidewalk, or is it bumpy and lumpy? Are there green pathways? What do they call them? Green belts, right? Are there green belts and greenery, or is it a lot of just like tall buildings and you're looking at like walls all the time? All those things also impact people's well-being. Social and community contexts. Are there opportunities to connect with other folks with MS, or just other folks that share other identities that folks might have? And then economic stability. We usually think about just income, like what's people's income level, but it's kind of more than that. Economic stability is also like cost of living, like how much does it cost to live where you live? Do you have to maintain 2 jobs to live where you live? Do you have healthcare in your job, right? And if you lose that job, are you going to lose your healthcare, right? So all these things that are not just about the number, like what is your income, but about the economic stability that impacts people's health as well. And so my point of talking a little bit about the doom and gloom, yes, I did, but my point in doing that is to remind us that health equity is more than just healthcare, right? It's more than what our doctor says to us. It's more than just our hospital care or access. It's bigger than that because it impacts all aspects of life. It's, again, financial, it's nutrition, it's neighborhood, it's all of this, right? So it's not just good healthcare and it's not just good doctors. It's all these things that impact our quality of life. So when we talk about health equity, we're talking about removing the barriers to quality of life. So that's like a very simple way. I gave you these like long definitions in the beginning just to kind of get us started, but a very simple way of thinking about it is just removing those barriers, removing the barriers to quality of life, right? So that we can all thrive. And so if we think about quality of life, it's a very individual thing, right? Again, individuation. So this is mine, right? So we can think about, I like this definition because it's simple, right? The sum of all sources of satisfaction, the sum of all sources of satisfaction minus the sources of worry. So if we all were to think about the puzzle pieces to our quality of life, again, individuation and thinking about differential needs, there might be some similarities and there might be some differences, right? And so in my little puzzle pieces, I have my family. There's a picture of me. Some of these pictures are me and some of these pictures are not me. So I pointed to the ones that are actually me. So there's a picture of me with my sons too, right? That's very important to me. That's part of my quality of life, being able to care for him and watch him grow. Yummy food is part of my quality of life. That's me at my wedding eating the delicious cake. I won't talk about how we didn't get to finish it, which I think is the story of most people's weddings, but it was a delicious cake and I do enjoy yummy food. So that's part of my quality of life, is enjoying food with my family. Play, like to go to Disneyland. Haven't been there in a while, but that's something that we do enjoy, leisure and family outings. Work is part of my quality of life in terms of the work-life balance, as well as in terms of being able to contribute to supporting my family. So that's part of my quality of life. Getting some sleep, that's part of my quality of life. Exercise, that's not a picture of me, but it's a good picture. I do enjoy yoga. So again, these are my individual puzzle pieces to my quality of life and to my sources of thriving, right? And so I would encourage you all to think about, for you, like the visual of it as well. Like, what is it for you? Like, what would be your puzzle pieces? And how are you maintaining those things, right? Because maintaining those things for yourself is also part of health equity, right? At the individual level. We could also be thinking about, how are some of these things challenges, right? Is it getting to work, commute? Is it having appropriate accommodations at work? Does that affect quality of life? Is it the stress levels? Because we know that with stress levels, our symptoms can fluctuate, right? So where does that fit into our quality of life as well? We may enjoy yummy food, but maybe yummy food isn't doing the best thing for us. So how do we put that back into our quality of life, right? In terms of balance, or thinking about our nutrition as well. Home, a place, a shelter. Do we have shelter? Do we have a place where we can lay our head? Do we have a place where we feel safe? Do we have a place where our family feels safe, right? So all of these, again, it's not just health, right? It's not just like, what is my health? It's all these other things too that impact health and health equity as well. So think about your puzzle pieces, right? Think about what would be in these squares for you when you think about your own individual quality of life, and even like living your best life as well. And so I do want to talk specifically about MS and quality of life, just a little bit about research, just a little bit. So research does show that clinicians are more concerned than patients about physical manifestations of MS, whereas the patients themselves, the people living with MS, are more concerned about their energy and vitality, any limitations to the roles that they may have. Again, for me, like being a mother and taking care of my son, or maybe being a wife and spending time with my husband, right? So role limitations, or even working, right? Emotional problems and mental health. Those were more important to the actual folks living with MS, while clinicians were more focused on the physical, right? I'm gonna come back to that in a minute. Other research that kind of supports this shows that sometimes the things that are focused on as the most kind of important indicators are not actually the most important indicators for a person. So some weak predictors of quality of life in MS are, in the research, are duration of the disease, neurological symptoms, disease subtypes, MRI disease burden, and forced unemployment. I don't have an explanation for forced unemployment. That one actually surprised me. But some strong predictors of quality of life are the impact of fatigue, the impact of pain, loss of autonomy or support, or having autonomy or support, communication difficulties, depression and hopelessness. So when I look at this, it's a reminder to me that the things that are stronger predictors of quality of life are the things that affect people's day-to-day, right? Which goes back to that individuation. Because if we only just focused on how much inflammation, or all the the disease indicators, we're gonna miss out on the actual things that are important to people's day-to-day, the things that impact their quality of life, the things that are meaningful to them, and the things that are actually the stuff that myself as a psychologist and other health professionals should be listening for, really. And so a first step in achieving health equity is humanizing and listening, right? Being humanized and being listened to, right? Bringing to the forefront the things that are meaningful and important, and the impact that they're having on your life is going to be a first step to achieving health equity, and breaking through a lot of some of the things we talked about before in terms of biases or assumptions about what folks should have or shouldn't have or what they should be focused on, right? So humanizing and listening, that's the first thing. All right. Oh, I wanted to also mention that some of these things are very impactful for folks from marginalized identities. We know this, and intersectional identities too, right? So African Americans had better health quality of life when they felt that their doctors understood how their symptoms affected their daily lives. And that was very important, right? Which is kind of what we're saying again, individuating, humanizing, listening to the actual day-to-day impact, the stuff that's important to people, not making assumptions, right? And so health equity, again, is this big thing that impacts all aspects of life. And in MS, that's not any different, right? And this slide only contains so much, right? So we've been talking about quality of care, but that can also be like care coordination, who's on your treatment team, is it individualized towards your actual needs, how is communication amongst those teams, health policies and systems that may impact people with MS, and those can be things that are more kind of the bureaucratic things within your doctor's visit. Even like if you run out of medication and you need a refill, do you have to wait until your medication is all the way done before you can get that refill? And if you do, does that mean that you are risking having your symptoms flare up somewhere between that medication ending and that medication prescription being refilled? And is that a policy that's just given to everyone because we think that everybody who, everyone needs to wait to run out of their medication before they can get their new medication, and not necessarily individuated to people's experiences with their own symptoms, right? So that would be something where, okay, yeah, it's equally, it's a policy that's equally distributed, but does it have equal impact on folks and their ability to manage their wellness, right? Financial, affordability of treatment, coverage. A lot of things overlap because your workplace may affect your coverage, right? And so if there are concerns about the workplace or employment, there may also be concerns about coverage, which then may affect quality of care, right? So all these things, I have them in boxes, but they're not necessarily separate. Reduced income, which can also impact employment, right? So are the waxing and waning of symptoms affecting how often someone can work or what work they're doing? And does changing that job or changing those hours impact their income, right? There may also be cases where folks may choose to reduce their income so that they can get a different coverage, right? They need Medicaid, and so they're going to reduce their income, but that may still have impact on their day-to-day costs, right? Their day-to-day costs may also be impacted by like what grocery stores are available, what food is available, where they can go to get this and that for their needs, where they're gonna go to get their mobility device, like all this stuff overlaps again. Workplace performance reviews, right? Are there biases in those performance reviews? Sometimes, right? Again, assumption of ability or assumption of disability or visibility or invisibility of disability, right? Tongue twisters there. But all these things may impact performance reviews, which then may impact folks' satisfaction with their employment, but their satisfaction with their work life and their ability to move up or move on in their work. And that again factors in with microaggressions, which are kind of these like mini statements that kind of add up to kind of feel bad. Like when someone says, well, you don't look like you're sick, so why can't you do that, right? That's kind of a microaggression. Or biased assumptions, right? And that can happen in the workplace. It can happen other places too, but when it happens in the workplace, it really is icky. And it can impact people's like work performance. Geography. This is kind of a big one too. So geography can impact access, where people are in the country or in the world, but even where people are in their neighborhood, right? Where is the closest neurologist? Where is the closest dietitian if that's part of your needs? Where is the closest clinical psychologist, right? Environmental health and safety. Are there other things that are impacting health, like asthma? We know that comorbidities can make symptoms worse. So what is the environmental health? Are we, somewhere where there's a lot of smog and fog and all this kind of stuff? Are we somewhere that's very industrial and noisy? Are we somewhere where, and this kind of goes in the landscape and layout, are we somewhere where, again, the sidewalks are uneven and it's hard to get around, or there's not good public transportation? It's hard to get to appointments, but it's also just hard to get to work. I remember in Cambridge, like the brick sidewalks are beautiful around Harvard Square. They're beautiful, but they are a pain to walk on. They are not very good for your knees and your ankles to be walking on bricks. So again, what is the layout and the landscape of where you live? A lot of older places don't have accessible entries, right? They may have stairs and hills and things like that. And so geography can have an impact as well. We know that there is earlier onset of MS in Black and Hispanic populations. So there's the impact on race and ethnicity. We know that there's higher rates in women. We're just beginning to understand rates in the trans and gender expansive community, but those are understudied, which means that, again, meeting individual needs can be challenging if we're not thinking about individual needs, right? If we're thinking about one size fits all across all of this, we're not meeting individual needs and we're not being equitable, right? And so, again, I have these different boxes, but this is all connected. And especially for folks who have intersecting characteristics or intersecting identities, you're a woman and you're Hispanic and you live in a rural place and it's hard to get access, all these things are going to combine in different ways to impact a person, as well as different ways in terms of thinking about solutions to how to address some of these areas of equity and inequity as well. I thought this was really interesting, and I thought to include it here in terms of intersectionality. This is from a project in the UK, but it included folks from all around the world. It actually was I was reading about it as a PhD project. Some of you may have seen it, where they spoke to different folks who were from the LGBTQ community, who also had MS, and spoke about their lived experiences and asked them to take a picture or bring in pictures of things that told a story about their living with MS, right? And I thought this one was really interesting and meaningful. This person was saying, this was a person from the US, that they went to Pride, Trans Pride, and that they were really excited that they had gender neutral bathrooms, but that they were upstairs, right? And so this is a person who identifies as trans gender and has MS. And so great, there's a gender neutral bathroom, but it's very difficult for me to get up the stairs, right? And so again, when there's these intersecting identities, these things can pop up in kind of unexpected ways where the intentions are good, but the individualized need is still lacking, right? And so I thought that was a really good, this little simple little sticky note that says gender neutral restrooms upstairs says so much for this person and their experience of intersectionality with their identity and their illness as well. There's, I have a reference page too, where a lot of these resources are. There's like a full project on this. They have like a gallery that you look at online, and they're also have information as well for folks who may be part of the LGBTQ community who have MS. And so just to summarize impact, right? Because we're gonna shift, I know, doom and gloom, but we're gonna shift to the empowerment piece. We're gonna shift to what can we do? But impacts quality of care, impacts access to care, communication during care even. Are you being listened to? Or do you feel like you're being respected? Well-being, we're thinking about quality of life and those puzzle pieces to our thriving and to our wellness, what's important to us. I wanna highlight that although there's all these health equities, they are inequities, excuse me, they are defined as kind of, they're unfair, but they're avoidable, right? And so I want to focus on the avoidable piece, because that means that there's places for like intervention, I guess. There's place for again, flipping the script, right? If they're avoidable, that means there's wiggle room in there for us to get a different outcome, right? For us to be empowered. So what can we do? So, I'm going to start on the outside and go inward. So some bigger strategies, the more systemic ones, right? You can think about those as upstream, midstream, downstream, are, impacting those laws and policies that shape the way communities look, urban development and urban planning and all these type of things, looking at racism, discrimination, poverty, ableism, sexism, and looking at all these inequalities, inequalities, and how they are showing up in policies or in laws, right? We can be looking at, as a society, we can be looking at living conditions, right? Housing, safe housing, housing with access to, again, green belts and grocery stores and nutrition, transportation, right? Violence and safety, access to jobs that people can make a living wage off of, access to education, inclusion in the classroom, reducing exposure to toxins, all these type of things, right? Which are considered kind of midstream systemic strategies. Those would be kind of like public health strategies. And then there's the health outcomes piece, right? Nutrition, chronic disease, stress, trauma even, right? Maternal health care, right? But these are kind of big things. And it's like, well, I don't think you're gonna leave here today like doing this. You could leave here today and write a letter to your congressman about these things, right? But I wanna kind of bring it back down to that individualized level of things we can do for ourselves to counteract or challenge the impact of health inequity so that we can then thrive, live our best lives as much as we can, and have that quality of life, or work towards having that quality of life that we all deserve, right? But I wanted to put this here, and I'm not forgetting the systemic stuff. I'm not forgetting it, but it's not necessarily something that you're going to leave here to do today and it's going to have a change overnight. These are things that are going to take time, and these are things that collectively our society can be working on, right? And we can be part of that. Obviously we should be, but that's not necessarily the focus. So what I want to talk about are empowerment strategies for reclaiming power and equity, right? Reclaiming power and equity, right? And so I have these divided into two kind of categories to kind of simplify, but I will go into more detail. So challenging and counteracting, right? So challenging the status quo, redefining things, flipping the script, right? And then counteracting the impacts is more about our individual health and our relationships. How do we leverage our individual health and our relationships to then counteract the impacts of these known health inequities on our well-being, right? And so a couple of different strategies here for challenging the status quo. I'm going to start with challenging the status quo, and then I'm going to go into counteracting, right? So challenging the status quo, I started earlier talking about things like implicit biases, health disparities, cultural competency, and things like that, because they are interrelated with health equity. So things that we can do for ourselves are remembering that you're not just a patient, right? You're a whole person. If you think about that quality of life slide, right? There are lots of things in there that make you a whole person with illness, but a whole person who is thriving or trying to thrive, and who has interests, and who has talents, and who has family, and who has interest. I said interest already, but that's important to me to have interests. I like gummy bears. I like yoga. I like making myself laugh, like I said before, right? But being a whole person, maybe your grandmother, right? Maybe your grandfather, right? Maybe your auntie or uncle, right? Like as a whole person, you're not just a patient, you're a whole person, right? And so then we talked about those things that, according to the research, right, clinicians are more focused on kind of disease related stuff, while folks are interested in on how disease impacts their actual day-to-day, right? So are providers just asking symptom severity stuff, Or do they really want to know the impact on the meaningful areas of your life? And if they are just kind of asking symptom severity stuff, how do you flip the script and make sure they understand the impact on the meaningful areas of your life? Now, I didn't say it wasn't going to be work. Like, it's not like it's just going to happen, right? So that takes a little bit of effort of bringing that into the conversation. Like, yeah, and this is how it affects me at work. And yeah, and this is what it means when I have to get up and use the bathroom. Bringing it back, and I have to interrupt playing with my, my grandson or my nephew outside, and run in the house because I have to use the bathroom, right? So what are the meaningful impact areas, right? And do your providers know about them, right? Redefining expert, right? You are the only expert on your day-to-day experiences, right? You're the only one who has lived your life every day. You're the only one who's done that, which makes you the most valuable member of your treatment team, right? And maybe you already know that, and that's great, and you're just getting reminded, but maybe you don't. And just to know that you are the only expert and you're the most valuable member. I'm not going to give a detailed story here, but when I was delivering my son, there was a lot of people coming in and out, right? They come in, they like kind of ignore me, they go to the chart, right? And they're like, and I'm thinking, like, I'm right here, right? I'm the only one of everybody coming in and out. I'm the only one who's been here the whole time, right? I'm the only one who knows exactly what's going on because I've been here the whole time, right? And so that's you. You've been in your life the whole time. You've been in your day-to-day experiences the whole time. So you're an expert, right? And you're the most valuable expert because without you, what are we talking about, right? What are we talking about? So redefining expert, right? And redefining, who's part of the team, which I'll talk about that as a separate point later. Well, later, meaning right now, right? So centering your own values and your own culture and what's important to you, again, going back to that individuation, forcing kind of that individuation on your treatment team. And I put treatment team like in quotations because a treatment team may not just be doctors, right? That could be your community healers or your spiritual and faith advisors. I might be blocking that with this. There you go. Your family members, right? So who is important to you to be part of your wellness journey and your treatment team, right? Bring those people, add those people, talk about those people, include your people on your own treatment team, right? Asking questions. I mean, that seems simple, like ask questions, right? But getting understandable answers to the questions that are important to you. So that the piece here is the importance. Like, what are the questions that are important to you? And how do you get those questions answered, right? And that might be with certain members of your team, your neurologists. That might be through doing like different types of webinars where you're able to ask folks questions or ask other folks who work with various populations, these type of questions, but get answers to the questions that are important to you, not the questions that are important to everybody else, right? Because that goes back to the day-to-day, like you're the expert on your day-to-day, right? Have health conditions explained in understandable terms. Like, are people using jargon all day long, trying to sound complicated and fancy? Like, what does that mean? Like, what does that mean for you in your day-to-day? What does that mean for you today and tomorrow and the next day, right? It can mean different things, but it would be helpful to make sure that that language is one that is understood. That also goes back to language itself, right? Does your treatment team need to include a translator? Can it? Is there access to one, right? Are there access to providers who speak the language that is of interest to you or of importance to you, or is your native language, right? Or the language you're comfortable with? Are there people that you, again, going back to the include your people, are there people who also speak your language that you want on your team, right? And that could overlap with the community healer or the spiritual faith advisor who may be ones who also speak your language, right? So those were things about, I'm going to go back just real quick. Those are things about challenging the status quo, right? Things that were about kind of breaking through a little bit of those implicit biases or those assumptions about who knows what and who's an expert, like kind of breaking through some of that. The next set is more about counteracting the impact, because we talked a lot about the impact, right? We talked about the impact on quality of care, impact on kind of health, impact on access, impact on nutrition and finances and things like that. So how do we then, if we're not going to work at the moment from a systemic level, if we're not going to write a new law or a new policy or change the way all of healthcare is set up like tomorrow, right? Then what else can we do on an individual level to counteract the impact? I would say one way is to obtain access to your own information. Do you have access to your own medical charts? Not necessarily the whole chart, but do you have access to the notes? Some organizations do that now, where you can have access to the notes, where you have your own like a patient portal and you can see the notes. And if you have access to the notes, do you read them, right? I like to read my notes because I like to make sure I'm on the same page with my providers. I also like to kind of see like, was my experience of what we talked about, what was like written in the note, right? And I also like to, and this might just be me, go and kind of prepare like, oh yeah, on June, whatever, we talked about this thing and this thing is still happening, right? To kind of like focus in on the thing that's important to me, right? So yeah, I'm in a system where there is a patient portal where you can see your notes, right? Medical notes. And so, yeah, using that's a great way to kind of counteract the impact of like biases, making sure health information is understandable, making sure your needs are being met, bringing things back up. Another like slightly personal story is that we learned that my 2-year-old has a peanut, well, not peanut. I learned this too. There's a difference between legumes and tree nuts. He has a tree nut allergy, right? And I went back into his notes that we had access to, and he had similar kind of symptoms a couple of months before, where he had tried like cashew ice cream, but it wasn't on our radar because it just wasn't on our radar. And then this time he had like a bigger reaction to like pistachios. But I looked back in the chart so that when I went to the visit, I could just say that outright. I could just be like, in June, he had this reaction, but we didn't know what it was. And last week he had this reaction, and this is what I think it is, right? So I used the notes to kind of prepare my narrative, right, of the information that I thought was going to be pertinent to kind of honing in on what I observed to be going on. And yes, he did have a tree nut allergy, right? Seeking comprehensive care and evidence-based treatment. I added this because it popped up in the literature, but I just want to come back to the evidence-based treatment is what works for you, because sometimes you do want to be focused on the research, but we also want to understand that the research is also at this level, often at this level of kind of universal again. And so it may not be the research about treatments for Black women who live in rural Indiana, or treatments for trans women that live in Central Florida, right? So we want to look to the research because it gives us an understanding, but we also want to think about in your own lives, what works for you, right? What works for you, what's working and what's not working, right? And making sure that care and the people on your treatment team are specific to your needs, right? Again, your neurologist is probably part of your team, but also, do you feel like you need a psychologist or a therapist, or do you want nutritionists or yoga, or again, a faith advisor or a priest, or, you know, make it relevant to your needs, thinking about that quality of life puzzle, what is going to help you thrive. And those are the things that are also part of your comprehensive treatment plan, right? Those are the things to bring in to the comprehensive treatment plan. And I would say, I think this is part of counteracting and challenging the status quo. Go in expecting dignity, respect, and collaboration. So I think that when we expect it, that we're more likely then to say something when it's not happening, than when we don't expect it and we're like, well, that's just because of this, or that's just because of that, or they were tired, or they were busy, right? But it's still, again, you're still a very valuable member of the team. So even if someone is tired and busy, shouldn't you still get the healthcare that you came to get, right? So I think the framework of like expecting it helps us then to, I don't want to say demand it, because that sounds very like demand it, but it helps us to then question it. And it helps us to then, on the next slide, I have provide feedback about the care that you're getting and the care that you want. Attend to overall physical and mental health. So that would be like, we talk about healthy behavior, stress reduction, but again, making it meaningful to you. Going back to this idea of differential need. Equity is about individual need. It's not about the sameness across everybody. So what does that mean to you? For me, it's yoga. To me, it's Afro beats, right? But for you, it might be something else. And day to day, that might change based on the waxing and waning of what's going on for you. So maybe today it's yoga, but tomorrow it's a nap, right? Or maybe this morning it was taking a walk, but this afternoon it's like Shavasana or something, right? So what is it for you? And how are those things kind of added into your life in meaningful ways? Like, again, what does that mean to you, right? And how is it meaningful to you? More about counteracting the impact. I kind of hinted at this. Giving feedback. We may, oh my gosh, I'm looking at the time. Okay, we're almost done. We definitely are. Giving feedback. Sometimes we're like, again, oh yeah, like they were just tired of this. If you're comfortable, give feedback. I'm one of those people who I will fill out the complaint. Like I will go and I will find the complaint form and I will fill it out and I will give feedback, because I feel like my feedback is not just for me, it's for the people who come after me as well. So is it feedback to healthcare or organizations or pharmacies about, the weight that you have for your medication, or city planning? In my neighborhood, we walk with my son in a stroller sometimes, and they want to be inclusive in this neighborhood. However, there's a train track, and to get over the train track, there's these stairs. You can't use the stairs when you have a stroller. So we get in the elevator, but the elevator is always dirty. It's always dirty. So even though there's an elevator and there's access, it's not equitable access because it's a dirty, smelly elevator. And so my town had, they had a sign like, oh, give us feedback. And I was like, yes, I will do that. And there was a sign that was join a virtual town hall meeting. And I was like, yes, I will do that. And I joined that and I talked about the elevator the whole time. They're like, any other ideas? And I'm like, how about a clean elevator, right? So giving feedback and finding those opportunities to give feedback and raise your voice. Part of that supporting your voice is joining groups and organizations for support and strength in numbers. Those can be groups like here, groups that are focused on MS. Those can be groups in your neighborhood. Those can be identity and culture focused groups, right? Finding your people again. Legal empowerment. I'm not an expert on this, but I did want to include a slide about it as a reminder of just knowing your rights. There are rights, right? There's ADA, there's Title IX, there's Title VII. And if you are a person with intersectional marginalities, all of these things may apply. And so doing what's best for you, you can only decide that. But sometimes folks from marginalized groups feel that they need to be twice as good to be treated equal. And if you add that into having this ability, there may be some hesitation in using accommodations. So think about yourself and what you need. And if it's coming from a place of concern about what people are going to think about it, I mean, you have to decide for yourself, what are the pros and cons of that, right? Are there things that would actually be beneficial in terms of those accommodations that are going to help you actually feel better and have less stress on your job? So I'm not here to tell people what to do, but just remembering, do what feels right, and what you do maybe paving a pathway for those who come afterwards. I had a chance to look up a couple of groups or like forums. So there's some stuff happening on social media. There's a group called We Are Illmatic that's about Black women with MS. I mentioned this project online for LGBTQ folks with MS, getting lived stories and photos that kind of connect to those lived stories. There are some resources in Spanish for folks with MS. And there are different support groups as well that may not be focused on particular subsections of individuals, but maybe places to kind of bring some of these issues and get ideas about what people do when they're feeling like their ability to thrive is being limited by other stuff, right? And so what I just want to end with is, again, you have the right to live your best life. And these are just many strategies, many, not a lot, but many like small micro strategies to kind of help with navigating that, again, by challenging the status quo and by counteracting the impact in these very subtle but impactful ways. And so that is my discussion for the day. I hope it was useful. I do want to stop with 5 minutes for at least a few questions if there are any. And I can stop sharing.
And well, I want to first start out and saying thank you so much. That was incredible. I don't know about anybody else, but I truly learned a lot. I love what you said about health equity being about empowerment. I thought that was incredibly insightful. I did want to start with the question of my own, if that's okay.
Yeah.
So you were talking about the puzzle pieces and how you have to kind of fit these together to create your quality of life. And because equity is so individualized, you kind of talked about it, but I just wanted to know, because it's so individualized, how can people really pinpoint what their individual puzzle pieces are in terms of meeting, the balance of quality of life?
Oh, that's a good one. I think that it can start small. I think it can start with, I'm calling it the basics, but not necessarily for everyone. What keeps you going? What keeps you moving? What are the things that if they were not in your life, you just would not be happy at all, right? Is it family? Is it work? Is it sleep? I know those are like some of the main ones that keep coming up for me. Is it yummy food, right? Is it gummy bears? And then from there, kind of expanding on that. And I do think it takes a level of, because we can be on the go, a level of those mindfulness moments to stop and think about that type of thing. Like, what are the things that are really important to me? And if they were not in my life, it would be very difficult for me to feel satisfied.
Okay, wonderful. Thank you so much. So for everybody else, if you have a question or a comment, you can ask it using the Q&A button in the app, which also allows you to send your question anonymously if you choose, or you can ask your question live by raising your hand. And to do so, click the raise hand button or press *9 if you're on the phone, and I'll call on you, and then you'll be able to unmute to ask your question. So let's see if we have anything. So far, Leah Snyder wants to let you know that it was a wonderful presentation. So
thanks,
thank you for that, Leah.
Thanks for being here.
And Casey, I was wondering, is there any questions on Facebook?
So on Facebook, we had a comment from Helene who said that income really does impact healthcare quality. Any thoughts on that, Dr. Landers?
Income really does impact healthcare quality. Yeah, I mean, absolutely, in various ways. My comment about income was more about, we can't look at an absolute value of a number and say, oh, this person makes $70,000, they're doing fine. Because we don't know what that means. We don't know how far that gets them. We don't know their healthcare costs. We don't know how much the medication costs. We don't know what their insurance coverage is. We don't know if they live in the Bay Area, which is very expensive, or if they live somewhere else where that can get them pretty far. And so absolutely, income as well as financial stability are very huge in healthcare. In the care, but also in how we take care of ourselves in terms of, again, our nutrition, what food we have access to, quality of our food, quality of our home, all these things. All these things are so connected. Quality of education. Okay. Yeah.
And so we have another question. This one's from Kimberly. And Kimberly wants to know, can you give the web address for the African Woman Group?
Yes, there is a hashtag which you can find or use in Instagram and maybe Facebook as well. I'm going back to it so that I can make sure I get all the letters right. It's hashtag Illmatic, but there's some capitalized and lowercase stuff. So let me pull that up or pull that out, actually. Do they have, if I put something in the chat, do they have access to it, or that just goes back to us?
No, I believe that you can present to everyone in the chat.
Ah, there we go. Okay, let me pull that up then. So it's hashtag we are Illmatic, but there's like different lowercase and uppercase. So that's kind of going to be the important part to find.
Wonderful. Thank you. And I'm trying to see if we have any more questions at this time. And looks like we might be okay for now. Well, that brings us to the end of our time then. If you missed any part of the conference, it has been recorded and will be available through the MS Focus Facebook and YouTube channels. Reply to your registration email for information on how to access recordings, or sign up for our newsletter to learn about upcoming events. I would like to let you know our next teleconference will be a town hall. Bring your questions with Dr. Ben Thrower, and it's going to be on Tuesday, April 5th. Our sincere thanks to our sponsors, to all of our attendees for your participation, and especially to Dr. Landers. Thank you so much for your time and we spent to prepare and share this information with us.
Thank you so much for having me.